Welcome to Cardio Radio, a podcast of the Ohio Cardiovascular and Diabetes Health Collaborative, also known as Cardio. This is Dr. Michael Constant from the Case Western Reserve University School of Medicine, and I serve as the principal investigator for Cardio, a statewide network of Ohio's 7 medical schools. Cardio is funded by the Ohio Department of Medicaid and shares best practices to improve cardiovascular health, diabetes outcomes, and to eliminate health disparities in Ohio's Medicaid population. The opinions and recommendations in this podcast are those of the presenters and not those of Cardio and its sponsors, and are not intended to be a substitute for medical advice. I hope you enjoyed today's podcast.
Hello, I'm Dr. Shanail Lampkin, a weight management specialist in the Metro Health System, assistant professor of medicine at Case Western Reserve University, and a member of Cardio's team Best Practices. In this podcast, I will be joined by 2 amazing weight management specialists to identify barriers that patients commonly encounter when trying to form a healthier diet, discuss the health implications of these challenges, and provide some helpful tools that providers can use to identify and work around those barriers during an office visit. With me today to discuss this topic are Dr. Eileen Seeholzer and Dr. Ron Magliola. Dr. Eileen Seeholzer is a professor of medicine at Case Western Reserve University. Dr. Seeholzer started the weight management clinic and diabetes prevention program in the Metro Health System over 20 years ago and continues to lead these clinics today. She is also a member of Cardio's team Best Practices. Dr. Ronald Magliola is an internal medicine and pediatrics physician, a weight management specialist in the Metro Health System, and assistant professor of medicine at Case Western Reserve University. Welcome. I'm excited to discuss these topics with you both today.
Thank you, Dr. Berry. Thank you for having us.
Thank you. I'm excited to be here to discuss this topic.
I would love to hear from both of you about some of the difficulties that patients have shared with you over the years regarding their food choices. Dr. Seeholzer, would you mind addressing this first?
I'd be glad to. One of the things we hear most commonly from patients about making changes to keep a healthier diet often revolves around food cost. And sometimes that cost seems very real to the patient. Sometimes it's actually perceived because when they look at what they think of as healthier foods, those foods are more expensive, but they may be forgetting things. So there's no denying that the cost of food's gone up a lot. But healthier foods don't always have to cost more, which is a common misconception of people. It depends on where you shop. We know stores vary greatly in their prices locally, and that's true across the country. Much of the cost sometimes is really about convenience foods and dining out foods as opposed to foods where you have to do a little bit of preparation. So one of the things I do to really look at what they mean by cost is to walk through where they're getting foods. Is the reason the cost is so high is because the salad they get is from a takeout restaurant in which the cost of that might be greatly elevated rather than getting, for instance, something like a salad kit at a store. This is often a good way to start talking through with patients, is to understand, to be efficient with them, where their extra cost is going to when they buy what they think of as healthier foods. And then based on their preferences and habits, then we talk through alternatives that give them what they were looking for in those foods that might be more expensive, but practically work for them. So that's kind of some of the initial tools I have, and swapping out things that have kind of similar amounts of meal prep, but improved nutrition for similar cost.
Those are great ideas. Dr. Magliola, I'd love to hear from you about this as well.
Yes, thank you for the opportunity. I think there is a notion that only fresh vegetables are healthy. I like to dismantle that assumption. I counsel patients that frozen vegetables are actually fresh vegetables that are frozen. In fact, they are often picked when they have acquired the most nutrition, and to some extent, canned vegetables often fit in this same category of being healthiest. I also concentrate some of my efforts during the visit on the best value. For instance, food delivery applications have embedded fees that further increase the cost of food, and that may not be appreciated, at least up front, by the patient. I think about how this translates to other subscriptions and memberships and things that our patients are spending money on, which may often go unutilized or certainly do not provide any significant value for my patients.
And also time commitments are another big part that really affect stressors in caregiving roles, and changing demands also really affect the ability to get healthy foods. And so one of the things about this is we want to have people look at those commitments along with those memberships to see, can they change things around to make it so that they can either reduce costs or increase time they can spend getting what they need to be healthier. Because those are very real challenges. Most of these folks are often spread too thin, working with responsibilities across employment and family. One of the things in addition to this is that when people are stressed and have those commitments, they often reach for those highly palatable foods. And those foods are often the processed foods with lots of fat and sugar and salt, not the frozen vegetables that Dr. Magliola was talking about. And for many people, those foods in the short term offer comfort in a time of stress. And they don't just come with costs, they actually create cycles of craving. And so some examples of this that, most common ones would be things like pizza and ice cream and things like that. They can lead to problems with increased costs of food on the unhealthy side, just because you're not getting good fullness or satisfaction from them.
And we often hear from our patients, it's really hard to resist. And in fact, we know this for ourselves sometimes. It's hard to resist those more satiating foods, especially at the end of a long, busy day.
Yeah, we know our body chemistries are actually set to make us more vulnerable to those cravings when we're tired, when we're in pain, when we need to concentrate. And those foods often help us feel good. And the problem is they don't actually create chemical or body chemistry fullness. They actually make us hungrier. They create their own consumption. Some people with these feel-good foods, which often make us hungrier, really aren't kind of captured by the cravings and they just need to come back. But there's other people who, once they start, really get caught in cycles of continued eating of them. And we call these trigger foods. And for those folks, they often need to stop eating a type of food altogether in order to really stay away from those foods cost-wise and stay away from those foods health-wise. So it's really an individual experience that we have to respect and tailor.
I agree. Dr. Magliola, are there any other difficulties that you've encountered with patients or that they've talked with you about?
Well, certainly there's a knowledge gap, and that can extend to skills, equipment, and other resources. And then there's the problem of inertia. That is, doing things the way they've always been done. For instance, our patients grew up in certain ways that from a generational perspective, some may have grown up with even a small amount of food and cooking knowledge, which would place them a little bit further ahead from someone without that advantage.
It's challenging to make change.
Certainly, we want to encourage progress and not perfection. People may not have the resources they need to prepare healthy foods, and it's our job to inquire about those resources because that may not be something that our patients readily report or think that we even care about. Examples can be broken equipment, limited space, restrictions on using a communal stove. Even electricity and refrigeration should not be assumed. I think about social eating as an important part of the human experience, and much of that social eating, for instance, meeting with coworkers or dating, takes place in restaurants. So as clinicians, we need to work with our patients to balance all of the good and joy of social eating with the best, healthiest choices to support our patients' goals. Also, traditions and events are possible potential pitfalls for patients, and I believe it is our role to help our patients manage their friends' and families' expectations. Healthy change is reinforced or weakened by many and other people in our patients' lives. Additionally, I focus on cultural staple foods as another important part of the human experience. As clinicians, we need to understand where our patients are coming from. For instance, recent immigrants may need additional support as they adopt a potentially more Western-style diet with different food availability and the pressure of acculturation. Finally, I help my patients navigate a built environment which may encourage more sedentary behaviors. Elevators, for instance, instead of stairs. And the most rewarding part of all of this is that it gives us as providers an opportunity to learn from our patients, really the chance to understand how the world works.
I think these are all very important points. If you're the one who's expected to bring your famous mac and cheese to the social gathering, but you don't eat mac and cheese anymore, or you use healthier ingredients or healthy swaps, as we like to call them in clinic, in your new recipe, others may notice and they might not appreciate that change.
Oh, absolutely. Managing others' expectations is an underappreciated part of lifestyle modification. An area to probe with patients involves delayed eating patterns. We often see patients who may skip breakfast and even lunch. Successful long-term maintenance of weight loss has highlighted the importance of breakfast as part of the weight loss journey. So looking at the impact of delayed eating, patients may be less energetic, less productive, and this can lead to doubling up on meals later in the day. Identifying these patterns may help our patients discover how to be their best throughout the day.
Very important point. Let's discuss some implications of less healthy diet choices. We are all aware of the impact of diet on any number of disease states: type 2 diabetes, hypertension, metabolic dysfunction, associated liver disease, just to name a few. Dr. Seeholzer, can you tell us more about how the barriers that we've discussed directly impact some of these diseases?
I'd be glad to. As Dr. Magliola referred to earlier, these families that are stressed for time and transportation and access to food, as well as funds for food, often only have practical access or time for processed foods. And this is magnified in the fact that those highly processed foods, especially those that are high in refined carbohydrates like pizza or French fries, which also have fat and salt added to them, donuts, potato chips, etc., these can worsen many chronic conditions that a great number of adults have, like type 2 diabetes, high blood pressure, cholesterol, cardiovascular disease, and they promote metabolic liver disease as well, and perhaps cancer. And so one of the things about these foods is these foods cause people at risk to have an increased risk of those chronic diseases, which will further worsen their health. There are 13 cancers that are linked to overweight and obesity, according to the Centers for Disease Control and Prevention. And in people with increased poverty, we know that the obesity rates increase as well. In addition to the things we would expect, as we talked about the cardiovascular pieces and these risks of cancers, other things really affect function. So one of the things we know is that obesity, particularly on the weight-bearing joints, the hips, the knees, the feet, the ankles, worsens and promotes arthritis in those joints, and highly processed foods may interfere with weight loss as well. So even if they're limiting their calories in those, their weight loss efforts might not be as effective. In addition to the impact on weight and joints, because processed foods often depend on higher levels, in particular of salt in those foods and decreased things like potassium and other things you'd find in fresh foods, it also promotes chronic kidney disease and hypertension. So these foods become problematic in that they aggravate the conditions that are already existing and promote the conditions that are already there.
Thank you for expanding on that. Dr. Magliola, you spoke earlier about the effect of different processes necessary for cooking healthy meals at home. Things many of us might take for granted, like confidence in the kitchen, having proper equipment to cook with, having knowledge of what a healthy meal should include and how to prepare one. These can all impact food choice. What are some of the ways you've encountered this in the office, and what are some of the ways that you have addressed this with patients during a clinic visit?
Thank you, Dr. Berry, for the question. I think that people aren't always confident in cooking, as you alluded to. So we may want to start with a simple recipe, maybe only using 4 ingredients, and then build from there. Given the time constraints in our busy clinics, this may be an opportune time to involve your dietitian or look into other community resources.
You're absolutely right, Dr. Magliola. Involving your dietitian or referring your patient to other community resources can certainly be beneficial. In fact, we've included a link in the show notes to a great resource from the SNAP Ed Partners website, as recommended by a dietitian in our work group and diabetes educator, Karen Bailey. The website lists recipes and even has a meal planning tool to help you plan healthier meals at various price points. Our listeners can share this government-sponsored link with their patients or print out some of the recipes to share. You can also try some of the recipes at home and see how you like them.
So I think, Dr. Berry, if we are comfortable, consider discussing how to acquire cookware with our patients. For instance, secondhand stores, yard sales, resales, rummage sales, open stock stores, and advise on ways to make healthier meals using cookware such as hot plates, microwave ovens, crock pots, air fryers. This may help expand options for healthier cooking in the home.
Food is personal. When discussing diet choices with patients, it is often best to avoid stigmatizing any type of food. It's very good to remind our patients that foods have no morals. They are neither good nor bad. Just some are healthier choices than others. This can help make the conversation more relaxed and honest. Dr. Seeholzer, what are some helpful tools or resources that you use that can help other providers not only identify barriers to incorporating healthier foods into their diets, but also to overcome those challenges?
Thank you for asking about overcoming these challenges. We talked earlier about the cost of food as a barrier, and we also mentioned things like having equipment and transportation to good food as barriers for getting and using good foods in our diet and our family life in a practical and useful way. These kinds of barriers are called the social drivers of health. And the thing that's exciting about practicing right now is social drivers of health have always been there, but now we can actually screen for them and sometimes connect patients to resources to help reduce or eliminate those barriers or social determinants or social drivers of health. Surveys for social drivers of health are usually in most practitioners' electronic health record. Alternatively, practices can use a validated tool like the American Academy of Family Practice's Social Needs tool, which is linked in the show notes as well. And these can help us just identify what the top ones are and hopefully connect to resources in which a patient can help find out what's in their area to help them.
That's great. In addition, on the Cardi-OH website, you can access a recording of a recent webinar on social determinants of health, which addresses screening and what to do with the results, something many busy clinicians often find challenging.
That's right. And one of the benefits of using a standardized tool to screen for food insecurity and other social determinants of health in the office is that it can be given by a trained support staff person and relayed to the provider and discussed at the visit. One of the things about asking about social drivers of health is we're not sure yet, because they're recently used, how often these screenings should take place. In one of the studies that was published in the Journal of General Internal Medicine in 2021, there was a recommendation against screening for social determinants of health only at new patient visits or annual visits. And this is because many patients don't come in for those visits, particularly vulnerable patients. So in fact, the article encourages screening for food insecurity and other social determinants of health, as well as offering guidance to connect for those things at all types of visits, at any visit type, particularly if the practice serves patients who are in an at-risk area or in a safety net system. So I think the important thing here is asking about it too much, as best we know, is not harmful. And the evidence suggests that it helps us get people at their time of need and connect them to what we have. So one of the things that's important here is patients can be referred for assistance. Social workers or care managers might be able to assist in the system. The Supplemental Nutritional Assistance Program or the SNAP applications are sometimes completed with that patient, with the social worker, and they wouldn't be able to do that on the phone on their own. Sometimes it's just too difficult. In addition, some medical systems have programs that directly link the qualified patients to healthier food options in their area for making food at home or having them pick up food. It's good to know the names of a few food banks and food services that are close in a neighborhood of a practice. And many practices have somebody in the practice who kind of keeps a handout or a list of those things that you can give just for local connection. So it's good to know the local programs and the community health networks that support vulnerable patients in an area. But in addition to that, using those resources like social workers or the larger networks that can address social determinants of health really ensures that we're getting updated information to our patients when they have the need.
Those are all great ideas. Thank you. Dr. Magliola, what are some other ways we can help our patients overcome those challenges?
Certainly. What comes to mind are evidence-based tools like motivational interviewing or solution-focused brief interventions that can be used during the office visit. These are going to help patients develop discrepancy between their ideal state and their current state. We can use them to probe patients about healthy choices that they are making as a way to encourage even more healthy choices. It's also important to know that our patients almost certainly have great ideas to get the ball rolling. Those small steps help build confidence for the future.
And these things you've shared don't have to take up much time in the office. One of the first questions I ask patients when they follow up with me about their weight is, what is the one thing you've done since our last visit that you feel was most successful with regard to diet and exercise?
Yeah, that's really good. Small goals, building on the simple things that they like to do, as I mentioned before, and of course, starting with that simple recipe and mastering it before trying a new recipe. I like to use magic wand questions. That is, thinking about a future where the problem, in this case, less healthy diet choices, doesn't even exist. And then asking the patient, how do you build the steps to eating healthier long term? We can also teach our patients how to manage inconsistencies. For instance, running late for work may prompt a patient to stop at a quick-serve restaurant, but in fact, a protein shake would be much faster, less expensive, and far healthier. Another point of intervention is during travel and vacations. Asking about the strategy patients use when planning travel routes may help a patient to consider healthier options while actually traveling to the location or to reserve hotels with kitchens. The magic wand question here is, how can you return from a vacation healthier than when you left?
Wow, that's very smart. I would have never thought of that, but that sounds like a great way to get patients engaged in thinking about and problem solving for themselves.
Certainly.
Dr. Seeholzer, any other thoughts?
One of the things we've talked about is meeting patients where they're at. And there's a power in going through the act of goal setting and then having patients, similar to what Dr. Magliola is saying, but think about the steps it takes to achieve that goal in a concrete way. And there's some tools that we can provide patients to do that. And one thing I would say for patients is the likelihood of acting on a goal or making steps toward a goal increases greatly when a person writes the goal down or says it out loud to another person. So those verbal acts and those written acts increase effectiveness and increase action. So what are ways in which a patient in a quick intervention with a physician or another provider can actually practically make a goal that's likely to do good? This is where tools like versions of the Healthy Plate, which are accessible online and have been shown to reduce cardiovascular disease because it follows what we call the Healthy Eating Index, can be used as a visual to say, oh, you know what? I could just increase the proportion of vegetables. I could reduce the proportion of starch or make the starch healthier. I can make sure I have a healthier or leaner protein. These kinds of things can help without a lot of words to give ideas of what seems to be an achievable piece and can help with healthier eating as well as helping weight management move in the right direction as well. The Cardio website has information to share regarding a comparison of the Healthy Plate as well as a DASH plate, which can be printed out as well. So these tools that are on the website are office-based tools that are pretty simple and quick to use and then can be handed to the patient, perhaps with you drawing lines on it or writing their goal on it in ways that they can see and connect with in the time in between your visits or in the time between your visit and time with a dietitian.
Fantastic. This has been a really robust conversation with both of you, and I appreciate your time. With the time remaining, let's go through a fictional scenario that a primary care provider may actually encounter in clinic that captures much of what we've discussed today. I'll be the patient, and you will each have an opportunity to be the clinician. Are you all ready?
I'm ready.
All right. The patient, Ms. Smith, is a 44-year-old female with prediabetes and a strong family history of breast cancer, presenting for follow-up on her most recent lipid profile and A1C. Her cholesterol is borderline, and her A1C has gone up from 5.9 to 6.2 over the last 1 year, and she has gained about 15 pounds in that time. She works the night shift in the ICU, 7 p.m. to 7 a.m., comes home in time to get her kids out to school, and then cares for her mother for a few hours before her nap at 9 o'clock. She doesn't eat until she wakes up at 3 p.m. because she's not hungry, and that meal is usually something that she picks up on her way home from picking up her kids. She admits that she is worried about her weight gain and increase in her A1C because her mom has type 2 diabetes, and she doesn't want to develop diabetes. She completed a social determinants of health screening in the waiting area, and it was negative. Dr. Seeholzer, how would you start the conversation with her about her eating habits?
One of the first things I would actually say to this conscientious, hardworking mom is I would congratulate her on making sure she's getting at least 6 hours of sleep or more after working the night shift on her work days. Getting at least 6 hours and a bit more is incredibly important to overall health and diabetes and high blood pressure risk. So this is one of her biggest assets. The thing that is a part that could be improved is it sounds like you usually pick up food.
I'm very stressed out with work and my responsibilities at home. My husband is overseas, and I have to do everything on my own. Plus, my mom is recovering from a stroke, so I have to make sure that she is okay too before I can even think about myself. It seems like everyone in the family relies on me to help with everything, and I just don't have time to take care of myself.
Oh, I completely understand that. That is very challenging. What are some of the ways that you can add some healthier meals that don't require you to do more prep work? Some things that you can have at home, perhaps, ready to go without you doing extra work?
Well, we do eat a lot of takeout because I know that everyone will eat it. Food is expensive, and I can't afford to waste money. My mom has always lived with us and she used to do the cooking, but since the stroke, she hasn't been able to. So now it's another thing for me to think about.
That's so challenging. Can you think of any foods that everyone might enjoy that you can have at home, like frozen foods, rotisserie chicken from the grocery store, salad kits?
Well, the kids really do like chicken tacos. I guess I can make those for them and have a chicken taco salad for myself.
That's perfect. The rotisserie chickens aren't fried. You can remove the skin to make it healthier, and you can have the kids have some of the stuff that's a little less healthy while you have the salad as well.
That sounds good. Thank you. So this interaction that we just had only took 3 minutes and 4 seconds to complete. Now for our second part. It's 8 weeks later, and the patient is back in the office for follow-up. But this time, she's seeing Dr. Magliola. Her schedule is the same. Her weight is the same. She admits that she hasn't made many changes in her diet. She tells you that she feels overwhelmed. She's just not sure if she can make another big change at home by herself. Dr. Magliola, how will you address her situation now?
Do you mind if I ask about your kids?
Sure.
How old are they?
7 and 14.
Those are fantastic ages. Well, there are a few benefits to making some of the healthier eating changes that you discussed last time. Are there things that the older kid can do to help support you so that you can prepare healthier meals?
Well, we used to have a chore chart, and that helped a lot. I'll have to find it.
Well, that's perfect. That can help take some things off your to-do list. What about asking them to pick a new, healthier recipe? If they are allowed in the decision-making process, it may get them on board with healthier eating.
Well, my little one is always trying to help out in the kitchen. I don't usually let him because he might make a mess.
That's understandable, but have you considered getting them involved in the cooking and cleanup process? It may give you the opportunity to model for them how to build healthier meals while teaching them the importance of healthy eating. And you wouldn't have to do all the work. It might end up being fun.
I didn't think about getting them involved. I'll try it. So that portion of the interview only took 1 minute and 40 seconds, but it gave us so much insight into what her life is like and also allowed the provider to give her some very helpful, meaningful tips on what she could do differently that can also allow them to have healthier meals at home, get the kids involved, and lead to a lot less stress for her. As we see with this scenario, we can use these tools readily in the office to help bring about significant and meaningful change for our patients and help to take down some of those barriers to nutrition that we've discussed so far.
So today we've reviewed some of the commonly identified barriers patients have to healthy eating, especially healthy eating on a regular basis. We've reviewed some of the medical implications of those less healthy choices. And we've talked through some strategies that clinicians can use to help identify the barriers that particular patients face in an efficient way and a personal way within a clinical encounter.
Some of the key takeaways from this episode include: please be sure to screen for disparities around food and access to healthier options. While the optimal frequency for doing so is unknown, it may be best to screen at different types of visits using a standardized screening tool like the Social Determinants of Health questionnaires. Being knowledgeable of the resources available in your clinic's community is also important in that it allows you to offer support as indicated. Names and general locations of food banks or surrogates, area farmers markets, and the like can all be helpful resources for patients. The health implications of these barriers are many, and it is our expert opinion that patients benefit from learning about the impact of diet choices on disease states like type 2 diabetes, hypertension, metabolic dysfunction-associated steatotic liver disease, and hyperlipidemia, especially when followed by practical tips for how they can make positive dietary changes to impact these types of disease states. Techniques like motivational interviewing and tools like the Healthy Plate diagram, which can also be found in the show notes, can be adapted for use for specific patient encounters. I would like to thank you both, Dr. Seeholzer and Dr. Magliola, for all the insights you provided in this discussion.
Thank you so much for having us.
Yes, thank you. I enjoyed our discussion.
And a special thank you to you, the listeners, for tuning in to Cardio Radio.
This concludes today's podcast. Be sure to visit cardio.org to learn more about the Ohio Cardiovascular and Diabetes Health Collaborative.